Good afternoon, everyone. Thank you so much for joining us. My name is Jessica Zavala, and it is my pleasure to welcome you on behalf of the Ohio Program for Campus Safety and Mental Health to today's webinar, Campus Suicide Prevention, Creating a Campus Safety Net. Before I introduce today's presenter, we are very excited to have an expert with us today. I do have a few brief announcements to share. First and foremost, CME and CEU credits are available, and the activity code for today's session is 35 days. That's 35 DACE. This code will expire on tomorrow, Tuesday, October 31st at 12 p.m. Please be on the lookout for information posted via the chat function regarding how to obtain credits if you are interested. Next, we invite you to join us for our next webinar on November 15th this year. That's at 12 p.m. as David Edwards, coordinator of Veterans Resources and academic advisor for the Brigadier General James M. Abraham and Colonel Arlene Greenfield Veterans and Military Student Services Center at Ohio University will present on supporting mental health of military veteran students, resources, and adjusting to civilian life. So you don't want to miss that talk. You will find additional details regarding these upcoming events on our website and social media. Feel free to like and to subscribe to our social media channels. We encourage you to post your questions and comments in the Q&A or chat function during today's presentation. And finally, this webinar will be recorded and the video will be made available for viewing on our YouTube channel. And now to introduce our presenter. Dr. Poland is a licensed psychologist and is an internationally recognized expert on school safety, youth suicide, and school crisis prevention and intervention. He has authored and co-authored several books and articles on this topic. Dr. Poland also authored the Suicide Safer School Plan for the state of Texas, the Crisis Action School Toolkit for the state of Montana, and the Florida STEPS School Toolkit for educators to prevent suicide. He is the past president of the National Association of School Psychologists and past prevention division director of the American Association of Suicidology. He is very dedicated to prevent and has testified about the mental health needs of children before the U.S. Congress on 4 occasions. He was the founding member of the National Emergency Assistance Team and has personally assisted school communities after many tragedies, including school shootings and suicide clusters. Dr. Poland also has received several awards, including the APA Division 16 Distinguished Career Award. So without further ado, Dr. Scott Poland.
Thank you very much, Jessica. It's indeed my pleasure to have a chance to talk with everyone today. And most of all, I hope to say some things that'll be helpful and meaningful to every single one of you. I'm pretty sure I'm not the only person today that had their life affected by a suicide. When I was actually a college student, my dad died by suicide. I'm not really here to talk about him, other than to say I have a pretty good idea of what you might have gone through if you lost a loved one to suicide. And our Surgeon General said, we got to talk about suicide prevention more in our homes, our schools, the workplace, and the places of worship. Provisional data for 2022 indicated more than 49,000 suicides. Here at NSU, we've really worked hard to create a campus safety net, trying to get all aspects of our private university working on suicide prevention. Suicide prevention is not my only job here, but at least it's part of my job. I'm going to describe today a practical program and some of the things that we've done here in the Suicide and Violent Prevention Office. But you know, it is a really challenging time in the world right now. I don't think I have to really list all the things that are on this slide, but we've got political division beyond anything I've seen in my lifetime. We lost more than 1 million Americans to COVID. Global warming is a major concern. We've had a war going on in Eastern Europe for almost 2 years, and now we have a war in the Middle East. Mental health issues, as I'm sure everybody tuning in knows, have pretty dramatically increased for college-age students. And at the beginning of the pandemic, one of my friends said, "You got to start talking about self-care." And I'm like, "Steve, my entire career has really been school crisis, but you can do this." And I really got involved. And I do believe self-care is incredibly important. And I developed a little model, and more about that in a moment. But where does all of the stress come from for college students? Demands at school, although some of them are working also, demands from family, demands from peers. They really get stressed out. And along the way, some people thought self-care is like selfish. It's not. It's about taking care of you, so you'll be in the best position to model coping and optimism and help others. So here's a little model that I came up with. I wanted every letter of calm to stand for something, but most importantly, to see for always thinking about what we can control, which is largely our reaction to all the things impacting us. The A, always being available to family and to peers to be able to help them through difficult times, and being alert for the behavioral changes in ourselves as well as our family and friends. And the L is for listening, truly taking the time to listen to others. And hopefully there's significant others in all of our college students' lives that will actually listen to them. But too often I hear from young people that too quickly somebody is dismissive about what they're going through, or they want to give them a little pep talk. You know, in South Florida, we're pretty greatly impacted by everything happening in Gaza and in Israel. And we actually kind of got a wake-up call from our students in our graduate program in psychology about faculty need to slow down a bit, take a moment, check in with students, provide opportunities for them to be heard, as opposed to just coming in with the midterm, for example, or coming in with the lecture we had planned the day before a war broke out in the Middle East. So the other thing besides truly listening, I think all of us have to limit watching disturbing, horrific news coverage. And I know that I really can't watch it. I cannot watch the horrific stories that are being displayed through all of our video outlets, whether it be networks or whether it be social media. But it's important that we all stop and try to do the things that we know are good for us. And the M for hopefully modeling optimism and coping. So to break down self-care just a little bit more, I could give everybody just one thing that I think is at the foundation of being able to manage difficult times, is getting proper rest. That's really easy for me to say, really hard for people to do. Diet and exercise, of course, tending to the emotional needs of others, kind of looking at the problem as outside of you and trying to be a little bit more objective about what we can do to manage it, and letting go of self-criticism. And in particular, finding the creative outlets for all of us. Maybe it's music, maybe it's journaling, maybe it's working in a garden, maybe it's painting, and finding those creative venues to basically express the unique things about us. And a lot of people every week go to the mosque, a temple, or to the church. And actually, that is a very big source of support. You know, the Center for Disease Control kind of simplified suicide prevention, saying it's all about connections. And when somebody dies by suicide, and that's the term I'm always going to use, died by suicide. You tell me my dad committed something, I might say you commit a crime, you commit a burglary. So those places of worship are wonderful places to increase those connections. But there's another side of this that I see as sort of a spiritual side of interacting with others by a set of values that include compassion, empathy, friendly, helpful, respectful of the incredible diversity in our country and in this world, and always trying to find a little bit of humor when we can. So that is another important part of this. All I can say is I wish every one of our leaders modeled those set of values when interacting with someone. It's okay to disagree with someone's viewpoint, but we do not need to attack their worth as a person. Spending time outdoors. And you know what I encourage students? Seek out the person in your life who's positive and encouraging every time you see them, and try to be that person for others. And you've just looked at all those I can statements. And it's important that those are the messages we use about how I can relax. I can do things that makes me happy. I can get more exercise. I can be a good friend by doing these things. And I've just been working in the last week with the American school in Taipei. Sadly, they had a suicide. And I'm a big believer in talking with young people about suicide, yes, but in small groups. So they'll ask questions and I can get a read on how they're experiencing this. So I had a small group of school leaders, and one of them just said, there's not enough hours in the day to get self-care into my schedule, but we have to all figure out a way to do that. Self-care is truly important. So what do we do in the Suicide and Violence Prevention Office here? We've made hundreds of presentations about suicide prevention on campus and in our county, because we believe talking about it is very important. We coordinate all of our efforts with Students Affairs, with Campus Safety, with the Counseling Center on the university campus. I'm a very big fan of the JED Foundation. I'm sure everybody listening is familiar with all their work for college student mental health and suicide prevention. So I'm on the university task force. We brought in the JED Foundation. We're studying all aspects of mental health for our approximately 22,000 college students here. We publish newsletters in the Suicide and Violence Prevention Office, and we've really been fortunate to interview a lot of really well-known people in the field. Most recently, we interviewed Craig Bryan from Ohio State, and we talked about his book, Rethinking Suicide. I think he's absolutely right when he says suicide is a wicked problem. He even compared it to car accidents and how we've had multiple approaches to reduce car accident deaths. And he talks about small improvements in protective factors and small reductions in risk factors can make a dramatic change. He also talks about making a quality of life, improving it for everyone so they see reasons to live. And when I read his book, I couldn't help but think about the night security person at the Hollywood Beach condo where we lived. He was an old guy like me. Bob fell away from work. He didn't have workman's compensation. Bob didn't have enough money to live. Miami is now the third most expensive city in the country. Bob's trying to live on $1,100 a month in Social Security. Bob's living in one of those motels that you rent by the week. Bob loved dogs, but he couldn't have one. You know, Bob wasn't our close friend. I mean, we just knew him because he worked in our building. But we kept trying to reach out to him to get him to utilize what resources are available. We wanted to bring him food. He wouldn't let us even visit him. You know, in one of those conversations, Bob said to me, Scott, I just wish I could come live on your balcony. I didn't understand the desperation Bob was experiencing. I had no idea he even owned a gun. Bob shot himself. He just didn't see life worth living. And Dr. Bryan's right. We got to make life worth living for everyone, regardless of whether they're college students or whether they're elderly Americans like me. Back to SVP. Every new employee at NSU watches our video about suicide prevention. And in particular today, I want to highlight our program with undergraduate students. And we have what we call a first year experience class. It's a small group of students. The instructor is meeting with them twice a week for the first semester of their college experience. And they get a lot of information about NSU resources, about surviving and being successful in college. So we started out during COVID with an online module only. But once students returned to campus, not only did they get an online module, we trained every instructor in the first year experience program. And we even offered, if the instructors are still a little uncomfortable with presenting the suicide prevention information that we trained them on and gave them the slides for, myself or one of my assistants will come in and actually do that presentation. And it begins with acknowledging exactly how I started today. Someone in the class may have been impacted by suicide. You're not alone. We're going to talk about a lot of resources. We're going to stay after class and we'll be happy to talk to you individually. But we believe strongly most suicides can be prevented and we need to talk about it more. And when you actually bring up suicide, if somebody is suicidal, it gives them a chance to unburden themselves, to realize they're not alone. There's help available. So how big a problem is it for young people? Basically, second leading cause of death, ages 10 and over to age 34. You're probably all familiar with the 2023 American College Association survey saying that 78% of college students surveyed had a moderate to high level of stress. And what percentage of students in that survey screened positive for suicide? 28%. So the scope of the mental health problems with the college age population is quite worrisome. And I remember decades ago going to a presentation about suicide prevention, and the presenter shared every chart imaginable. I finally raised my hand and said, I knew it was a problem. That's why I came in here today. I want to know what to do about it. And that's largely going to be my focus today. But it's important that we give people correct information. And we do this in undergraduate classes. We do it at the graduate level. Various graduate colleges have mandated suicide prevention for every incoming student. But we need to realize we've got to increase their connections to home, school, family, the workplace, and to places of worship. And the good news today, nobody wants to die 24/7. They're actually ambivalent about it. 1 minute, my life's a series of never-ending problems. Not am I making, not getting any better. But a few minutes later, there's a glimmer of hope. That's why the intervention of any one person can make all the difference in the world. And the suicidal individual, they don't actually want to die. They want to end what they perceive as unendurable pain. They don't see alternatives. They don't see a way out. They have tunnel vision and constriction with regards to their thinking. So there's a slide about how much they go back and forth. And I'm working on something now for one of my projects, suicide proofing the home. The bottom line is, if an American attempts with the gun, they rarely get a second chance. Guns are lethal most of the time. And one of the people we interviewed for our newsletter, Dr. Anestis, who wrote the book Guns and Suicide. Here's what the book says. Guns are only used in 5% of suicide attempts, but they result in slightly over 50% of suicide deaths. Then he goes on to say, perhaps the most powerful tool we have to keep a suicidal person alive is to remove the lethal means. And there's a website at Harvard called meansmatter.com. They have surveyed, looked at the literature all around the world. You remove the lethal means, suicide rates go down dramatically. Talking about it makes everyone safer. You know, if it was up to me, every kid that was graduating from a high school anywhere in America would learn the warning signs of suicide, how to get help for yourself, how to get help for a friend, how to utilize 988, how to push the button on their smartphone and be connected with the crisis helpline. But rarely do kids graduating from high school know how to get help if somebody is suicidal. Now, here's a little memory thing to help us all remember what to look for. And it's all about, is the path warm? We're looking at suicidal ideation, substance abuse. We're looking at purposelessness, anxiety, agitation. Is somebody feeling trapped, hopeless, withdrawing from others? Are they angry? Are they reckless? Do they have significant changes with regards to mood? And maybe somebody would put this in the chat box. First of all, who's the most at risk for suicide in America? That's an old white guy like me, if we have family, health, and financial problems. But we're very concerned about suicide rates have increased for minority Americans, especially for Black youth. But here's what I hope somebody will answer. Who is the most protected against suicide in America by race and gender? And we'll touch on that towards the end. But in our presentations to students, we want to have them be able to identify the urgent warning signs and changes in mood or behavior, comments about death, dying, and suicide, researching suicide, purchasing a gun, taking steps to get a weapon, stockpiling their drugs. You know, with regards to suicide proofing the place of residence, it kind of makes sense. Locking up the guns, okay? Locking up medication. But where it gets really complicated is, how do we secure things like belts and ropes? And then you all know that sometimes the suicidal individual, maybe they've even been hospitalized. Now they're out of a hospital. They have a little more energy now. They're putting their affairs in order. They're giving away prized possessions. They're making out a will. Suddenly they appear a little calmer because they have their plan. And in particularly with adolescents, as well as our undergraduate students, they can just simply be overwhelmed by everything that's going on in their life. So what do we want somebody to do? Take all threats of suicide seriously. Call for help. Stay with the person. Know the resources at our university. Call the Student Counseling Center. Walk them to the Student Counseling Center. Make sure they have 24-hour crisis numbers. Be empathetic. Truly listen and grasp what the person is facing. Ask directly. You know, for decades, I always use 3 questions. Have you ever attempted suicide before? Are you thinking about it now? Tell me, how would you end your life? I used to work in Houston, Texas. One young person said, I'm going to jump off a cliff. Well, there's no cliffs for 100 miles. I asked a lot more questions, but the urgency wasn't quite the same as the young person who said, I'm going to shoot myself with the pistol. It's waiting for me in my room. I pointed it at my person yesterday. Can you see where I'm never going to let that kid out of my sight? I'm going to use whatever involuntary commitment procedures we might have. I'm going to be using mobile crisis teams. I'm going to be utilizing the campus safety officers. I am literally not letting that person out of my sight. And I've become a really big fan of the Columbia Suicide Severity Rating Scale. And if you're familiar with it, and I have my clipboard right here, it basically has 6 questions. Of course, I'm going to say suicide screening and assessment is more than 6 questions. It's gathering a lot of information, but we do need to use standardized questions. So what do we want everybody to avoid doing? Being critical, judging, making light. Even if I just phrase it, now I know you'd never harm yourself. Can you see how I just stopped the very communication we need to get started? And we want our students to know the importance of getting a staff member involved. And if not a staff member immediately, calling 988. So staying with the person. Don't agree to keep a secret. Get college staff involved. So I want to give you an example. The good news, I get to present to lots of student groups here, medical students in particular. And one of the medical student groups, when I put this slide up, he just banged his head against the mirror. He's basically saying, ever since the breakup, I haven't been able to study. I'm about to flunk out. I just had a severe argument with my dad. Or my partner just broke up with me. And then you turn to students and you ask them, how would you respond to someone who just said this to you? And I see this as the absolute essence of suicide prevention in this country. And you don't have to have a master's degree in social work to know how to respond. You know, with the first medical group that I presented this slide to, they act like this was the most difficult thing in the world I was asking them to do. I was even wondering, did I somehow not present this right? Because it did not go well. And actually, the Judd Foundation has a little PSA about, awkward, but here's how you do need to respond. And, the bottom line is, unfortunately, this is hard for us to do, but we do need to respond with empathy. We need to ask directly. We need to call for help. So it is so important and so basic that everybody know to respond with something like, I can't imagine what you're going through. I'm here for you right now. Are you thinking of suicide? You're not the first person to have those thoughts. I will stay with you. We are going to get you help. Now, after the presentation, a number of our first-year medical students came up to me, and they basically said, you know what you were presenting today? I've never heard anything like this before. And I believe that this is information that should be presented to every undergraduate everywhere. And if you want these slides, send me an email and I will certainly make them available to you. So this is basic information, and this is exactly what we want to present to every new student everywhere at NSU. And we've made progress, but still up to the various colleges about whether or not we get to present to students. And of course, we emphasize if there's an immediate danger, call 911. And our campus security is immediately notified when 911 is called from the campus. And of course, we want every student to know about the free counseling that is available at the Student Counseling Center, and the fact that they have a 24/7 crisis line. And the university has care teams operated by Student Affairs. We have a counselor in residence at the residence halls who is a graduate student, a doctoral student in psychology. And we want students to go to the campus adults. And we also want them to at least see their parents as a source of help for them also. So we already talked about 988 or 1-800-273-TALK, or utilizing the crisis text line. You know, in interviewing students for our doctoral programs, when a student tells me as an undergraduate, I volunteered at the crisis line or the crisis text line, that is really something that makes a lot of points with me. And here in Broward County, where I reside, call 211, and they are familiar with all of the local and state resources. And sometimes a person just has to be taken to an emergency room, and it is critically important that that be done. And Florida has the Baker Act, so we can work with the Baker Act team, and every year a number of students do get involuntarily hospitalized, and then we're working on their reentry when they come back. But every state varies a little bit in terms of the commitment procedures. So here's a question. Should a university counseling center contact the parents of a suicidal student? You're going to hear my take on this, which is basically, let's at least bring it up. Let's say to a student something like, what do you think about getting your parents involved? You're far from home. This is your first semester in college. There's a lot of things happening in your life right now. I've had really good luck with getting a supportive reaction from parents. What do you think? So now, why is that so important to me? Why am I emphasizing student counseling centers should at least consider it, bring it up? Here's a case. I've been involved in many legal cases, but on this one, I had to sign one of those do not disclose agreements. So I can't tell you what university it was. I can tell you it was prestigious. I can tell you the student had a full scholarship and the student was far from home. Just before the Christmas vacation, he did a phone intake, and he admitted, last year as a high school senior, I drove to a bridge. I was going to jump, but I didn't. But I've been having those thoughts again. And basically, the University Counseling Center notes were along the lines, well, we knew he was going home across the country for the holidays, and we said, I bet things will be better. So he comes back after the December holidays, and he walked into the counseling center early in January. He admitted that he was researching how to die by suicide. They gave him the CCAPS. He scored at the 99th percentile on depression on that instrument. Well, they made him an appointment as quickly as they could, which was on the 15th. And he shares again that he's researching how to kill himself. And he says his partner just broke up with him yesterday and repeated again that he was researching how to kill himself. They made him a follow-up appointment with a psychiatrist, only he died the day before that appointment. No evidence existed that a safety plan was developed. So when I first started writing about suicide prevention in schools nearly 40 years ago, we were using no suicide contracts. You need to know something. Those have been sorely criticized. Why? They're all about what not to do. Safety plans, written safety plans. But in some of my cases, the mental health professional says, well, I discussed safety with them verbally. My response, that is not good enough. Safety plans should be written. Internally, what can you do to calm yourself down when you have those thoughts? Externally, who can you contact? And then, of course, all the crisis numbers would be on the safety plan. I asked the students, take a picture of your safety plan right now, store it in your phone. And if I'm seeing them subsequently, I'm going to always be saying, let's get out that safety plan. Let's look at it. Let's think about what else could be added. So the Student Counseling Center representative just stated in their deposition, they had no idea a safety plan needed to be written, and emphasized it was discussed verbally. Also said, no idea that a breakup could precipitate a suicide attempt. And the campus counseling center policy was never to notify parents. So what's the most typical precipitating event? A young person has been thinking about suicide for a while. Severe argument with a parent, breakup of a relationship, maybe about to be kicked out of school, or maybe flunking out of school, or maybe some severe humiliation. Those things have been known for decades. We all need to be alert. What do you think the outcome was? The case dragged on for several years. Ultimately, the college settled out of court. And when that happens, the problem is we don't really have case law, nothing we can direct somebody to, nothing that we can learn from. But I do talk about the case. I just can't give you any more details. But what am I asking you to think about? At least bring it up. There's nothing stopping a student counseling center staff member from saying, you know, I think it would be a good idea to contact your parents. It's up to you, but I think it would help. What do you say? Let's call them right now. So I hope you remember that. And if you're wondering, who is the most protected group against suicide by race and gender? Jessica, it's Black females. Then the question is why? Sisterhood, faith, and purpose. That takes me back to Bob, the security guard at the condo. He wanted to come back to work, but he was in a walker. He couldn't come back to work. He didn't have a purpose. Even if he could have just got a pet. You know, an amazing number of the students in our graduate program here, they have pets. Pets do so much for us. Pets give us purpose, for one thing. And having responded to countless tragedies around the country in schools, you know who students really want to see? Not me, a psychologist. They want to see the therapy dogs. And they can be incredibly important. I wish I had time to quote many of the wonderful giants in the field that have been interviewed for our newsletters. I'm a very big fan of Joyner. I think he has the best theory there is, the interpersonal theory. If Joyner was on here today, he'd say, two main factors. Does somebody perceive themselves as a burden to their family? That's worrisome. Does somebody have thwarted or low belongingness? That's worrisome. But they have to acquire the capability through reckless behavior, maybe cutting, non-suicidal self-injury, maybe an extreme eating disorder. Be alert for someone acquiring the capability. But Joyner said, the problem is we might mischaracterize the risk level, or we get it right, but we overemphasize protective factors, or we just don't take enough steps to keep our client safe. And David Jobes is absolutely correct. Shocking lack of curriculum-based training on suicide risk assessment and management across all healthcare disciplines. So in our APA accredited clinical psychology program, the course I teach is an elective. APA does not require a competency in suicide risk assessment and management. It's not required to become a licensed psychologist, a licensed social worker, a licensed professional counselor. It's kind of hit or miss. And as Job said, most of the time when we learn it, it's actually in the field. And I'm a licensed psychologist in Texas. I have been for 42 years. I've never had to take one single CEU hour on suicide risk assessment and management. We need to change that. The last I knew, about 8 states require some continuing education. So I'm going to turn it back to Jessica. I'm really interested in knowing what kind of questions you might have. There is part of my team here and the Suicide and Violence Prevention Office. We have some work study students, and we have a lot of volunteers. And I'll just say one more time, Surgeon General's right. We got to talk about suicide prevention more in our homes, our schools, the workplace, and places of worship. So Jessica, what comments or questions do we have?
Well, first and foremost, Dr. Poland, I just want to thank you, and I want to ask all of our participants as well to join me in thanking you for that very informative presentation. And I have some takeaways already myself, certainly for clarifying that self-care is not selfish. That was kind of my first note. And certainly the self-care model, that was very, very reassuring and, just great, some good information to share. And so I'm going to open it up at this time for questions. And you can see there's a lot of information and comments that are coming through in the chat. So I do want to open up. We do have some time available for our participants. If you want to type it within the chat as well as the Q&A function, you can feel free to do so at this time. And again, we still have some time. And I am curious because you did mention at the end that there are 8 states that require CEU training and education based on suicide. Do you happen to know which states
I really
those
can't
are?
rattle them all off, but I know the
Okay.
state of Washington does. See, it gets confusing because some states might require it for psychologists, some might require it for social workers, some might require it for licensed professional counselors. And yes, FYE classes have suicide prevention information here, and we are just delighted to be able to provide that information. If it was up to me, we would be doing it for every graduate student as well. We're actually working on that. My college is on board, the medical school is on board, but there's still other graduate colleges that, we keep basically making them aware that this information is available, trying to, remind them, trying to respond. The other thing that I've asked for, I said every new employee gets suicide prevention. I'd love to do a reminder. And, time is valuable, but probably everybody listening, like myself, has these required modules that you have to do. And, you're probably immediately thinking of some of those topics. So
Sure.
far, I've been talking with the person who could push the button and require it, but I have not been able to get them to do that as yet. And if there's not a question coming in yet, I wanted to share one quick thing, Jessica. Do we have a specific question?
We do. We do have some questions pending, so I do want to get to those. And I also want to state, if you are on here from a state that does require or does have it within, whether you're a licensed psychologist or social worker or counselor, please feel free to let us know. I'm just very curious regarding that. But there are a number of questions, and we may not get to all of the questions, but I do want to go ahead and try to address some of the questions. First question is from, looks like Kim Younger, and it says, why does resiliency appear lower in college age students today? What has attributed to that?
I wish I had the answer. It's important that the keys to resiliency, surrounded by loving, caring family and friends, problem-solving skills, always being optimistic about the future, and having opportunities to vent strong emotions. And resiliency is critically important. It's largely a learned behavior. We could theorize our younger people not experiencing, consequences and learning from mistakes, and parents trying to fix too many things for them. I don't know. That could be part of it, but resiliency really needs to be a part of, our coursework and our emphasis as well. And I know, I remember one student during COVID when everybody was online for so long, but he said something I thought was really interesting. He says, why can't part of my assignment, my homework, be self-care? That's what I need. And I really think that that's something we should all remember. I'm hoping that an enduring thing out of the pandemic would be more importance on self-care. And Jessica, I saw one question, safety plan.
Sure.
Google Brown and Stanley, which is the most well-known safety plan, Brown and Stanley, and there's a safety plan. Or, you can write your own, but it's really just about internally, externally, what can I do, and who can you call? How do you calm yourself down? Do you know anything about mindfulness, and making sure all of the numbers are there? And I like to sit next to the student, so we're working on this together, not across the table.
Right. And so there's a question beyond training for students and staff and suicide prevention. What other strategies do you recommend for campuses? And I'm going to lump these other two questions within this regarding QPR and mental health first aid. Of course, as those have been, really widely and broadly implemented within campuses.
Well, that is absolutely, I support all mental health, all wellness initiatives, and one of the things I like to ask students, really any grade level, whether they're in a middle school, a high school, or a college student, I like to ask them, who is your go-to trusted adult? And, when I get the most concerned is when they don't have one. And you didn't mention it, but I've actually responded to 17 campus shootings, okay? And what I really think is that most tragedies can be prevented if young people, because they always talk to peers, if peers just knew to come forward. And, we had a young woman in Massachusetts who actually went to jail. She was the one that told her friend Conrad, get back in the car, you want to kill yourself, okay? Now, maybe it's more of a moral issue than a criminal one, but it's almost like, where are we missing teaching kids, first of all, that suicide's nobody's fate or destiny, and that the intervention of any person, and get adults involved. And I love to see students at all levels surveyed about, how do we make our campus safer? What are your concerns? What do you need that we're not doing that would promote mental health and self-care? I just think the students themselves have the most important information.
Yeah, no doubt. And, certainly agree with that. And thank you for sharing that point. I also want to thank, it looks like we have a couple of attendees on from Kentucky who have shared that their state does require suicide assessment training at least every 6 years at minimum. So thank you both for sharing that information. There's another question here regarding liability, and I think this is back to the case you presented, Dr. Poland. And it says, is there potential liability if you don't inform the parents of suicidal ideation, particularly if it's considered an emergency and then the student is transported to ER? And I think they're speaking of, in the case, if the parent is not supportive, could that, situation evolve to something that's, not positive or worse?
So for the most part, colleges have prevailed in these lawsuits. We go to middle school and high school, and we don't tell parents. In a few cases, the schools have lost those cases. The vast majority of them settle out of court. So again, we don't really have the hard and fast lessons. I encourage mental health professionals to always, first of all, work as a team and have supervision available, or at least collaboration with a colleague. Document all the steps you are taking when the student is suicidal. And I believe absolutely, elementary, middle school, and high school, we must tell parents. The only exception is if you believe that the parents are abusing their child. Now we're calling protective services. All right. All of this becomes a big gray area at the college level. And my answer is, at least document you brought it up with parents. And I think we could bring it up in a way that might be pretty convincing. I've been at this, many years. I believe I can get a supportive reaction from them. I think they care about you. What do you think? And I thought of one more thing I wanted, just because somebody put up that SAMHSA does have a safety plan, but I want to make sure everybody is aware of the SAMHSA Suicide Safe app. It is free, and I encourage you to download it and put it on your phone. SAMHSA Suicide Safe app. It has case studies, and it also has the SAFE-T, which is a screening instrument looking at protective factors and risk factors. All of this is very anxiety provoking for us, and that's where working as a team is so important. I would always tell a student, you're to sit in this chair. I'm going to bring in Beverly, the office assistant, and she's going to be sitting with you for a moment, because I'm walking down the hallway, or I'm getting somebody on the phone so I can do a quick consultation. And I was on the other end of hundreds of those phone calls. And it was always the psychologist, yes, I'm glad that's the right approach. I'm glad you've done these things. Maybe here's one more thing that you might consider. So it's very anxiety provoking for the mental health professionals.
No, absolutely understood. And there's actually looks like a comment also, just really thanking you for highlighting and advocating for therapy animals on campus. And so and the increased usage of that, and certainly that's positive regarding student mental health. So just really thanking you for that. Um, and so I do want to thank you for your presentation. I don't think I've missed any questions or additional comments, Dr. Poland. Oh, actually, there's just one last one that's come through regarding the FERPA. And if you could just kind of briefly speak to that and
Sure.
sharing that info with parents.
So 99.36A, in an emergency situation, you can and should share information with everyone who needs to know. You see, I interpret a student being suicidal as an emergency. And if I ever get sued, sue me for telling someone something you don't think I should have shared with them. So, and I just believe strongly, let's just take, extra efforts to try to keep the student safe. But I know this becomes very complicated when they're 18 years of age and older. So, and I say this a lot, which is wherever we work, it's like every campus deals with a lot every year. And I think it's important that the key people sit around the table and talk about what's going well, what's not going so well, what do we have questions about, what did we learn, what could we do a little bit better? So maybe as a result of the webinar today, some questions have come up that you need to talk about with the key people on your campus.
Well, certainly, we're hopeful as well that this isn't certainly brought up some opportunity for additional discussion and conversations, not only at campuses here in Ohio, but at campuses that have joined us and across the country. So again, thank you so much, Dr. Poland, for this very intriguing, very insightful and informative webinar discussion today. And I want to thank our participants for joining us. And we hope to see you back again next month on the 15th as we welcome Ohio University to talk more about supporting our student military veterans. And so one more time, if you're looking to obtain CEU credits, that code is 35DACE. That's 35DACE. And Chris has already posted it in the chat. And again, we look forward to seeing you next month. Thank you again, Dr. Poland. Have a wonderful afternoon, everyone. Goodbye.